This is my suicide prevention update. It might be a little strange, but I have to stand up. I just never presented sitting down. I'm Colleen Carpenter. I am the director of Stop Suicide Northeast Indiana, and also the Action Over Silence project, which is working to end veteran suicide. And you'll hear a little bit more about that. But when I asked Cassius, hey, what do you want today? He said, well, it'd be nice to be updated on some of the data. So I'm going to do that. But then I also wanted to do some education around our crisis continuum of services we have in this area. A lot of folks don't realize that we've built up a continuum of services for people in crisis. So I thought I would cover that. And then some exciting things that are happening because September is suicide prevention. So we have a number of, I have a number of goals with this presentation. So these are up-to-date data, and I'm realizing for those in the room, I'm blocking your access to the slide. So this is year-to-date as of July 30th, and these are straight from the Allen County Board of Health. You'll see that we've had 41 suicide deaths this year. At the bottom on the left hand of the slide shows you where we were this time last year. Not good. We have 9 additional suicides already this year. And what I did with percentages is the black is what's happening with suicide deaths, and then the purple is how, you know, these groups and what percentage of the population they represent. So suicide is often more common with men. So 78% of men died by suicide this year. 78% of the 41 who died by suicide were men. 22% of the 41 who died were women. 80% were white. 15% were African American or Black, and 5% were Asian, 5% were Latino or Hispanic. And the numbers don't add up. It adds up to 105% because there's someone in there who identifies as multi-race or gender. And then veterans, unfortunately, make up 19.5% of our suicide deaths. So I wanted to point out that, you know, if you look at the purple percentages, we have, you know, a higher percentage of white people dying by suicide than are represented in Allen County, normally just slightly higher. We do have a slightly higher percentage of African Americans dying by suicide than, you know, we have 12% of our population identifying as Black or African American in Allen County, but 15% of the deaths being of people who identified as Black or African American. And, you know, looking at veterans, that's the biggest disturbing statistic is veterans make up 5% or 5.3% of Allen County, and yet they make up almost 1 in 5 of our suicide deaths this year, which is another reason why I think we got the grant to work on veteran suicide prevention called Action Over Silence. The age range of the suicide deaths were age 17 to 98. In some ways, this is good news from a youth suicide prevention standpoint. 17 is the youngest suicide death we've seen this year. That is one small good news out of this slide, is that we don't have younger people taking their life yet this year. I mean, younger than 17, but sadly, we do tend to see 10-year-old, 12-year-olds, 14, 15, and this year we don't have that. Average age is 48 years old, but in our general population, I shouldn't say percent, say years. In general, Allen County, our average age is 36. So basically that's saying that suicide deaths are tending to happen in populations slightly older than the average person this year. That's not always true, but that's what's going on this year. And in terms of education level, I'm not sure if this is helpful. Some people find it helpful, but 27% had a high school degree, 24% had some college, no degree, 12% had associates, 22% had a full bachelor's degree, and then you've got a mix of master's, doctorate, and then the light blue, which is 3%, is under 8th grade. The only thing I can say in terms of comparing averages in Allen County, 31% have a bachelor's degree. I believe that's the data I saw yesterday. And what we see here is 22% of the suicide deaths were people with bachelor's degrees. And I can share these slides if this is helpful. This I find very interesting to look last year versus this year. So the purple bars are this year. And the blue line is last year. And as you can see, we started out the year blowing out of the water suicide, like twice as many people died by suicide in January than last year. Same with March. May was elevated, February was elevated, but then interestingly, look at what happened this summer. We did not have as many suicide deaths in June and July as we did in 2024, because that blue line represents 2024. I remember last September, we had 4 suicide deaths in the first couple of days. So I hope we don't repeat that pattern from last year. But we'll see. And then looking at age groups, you guys might be interested in this, is, we've got, unfortunately, 5 people who fit between ages 5 and 24, but then 9 in their late 20s, early 30s, 6 in the mid 30s to 40s. And then, so our highest group of having suicide deaths this year is really the mid 20s to early 30s, followed by the age 45 to 54, and then 65 to 74. In past years, it's clustered more here. So this is a little bit of an increase for us over past years of people dying and then at an older age. Okay, so any questions about data? They're kind of stark and a little depressing. They only represent deaths. So there are a lot of suicide attempts, some of which those folks go to the ER because it's so serious. Some of folks wake up and had taken pills the night before and don't take themselves to the doctor and realize that their suicide attempt was not fatal. So these do not represent all the suicide attempts. It doesn't represent all the folks thinking about suicide but not acting on their thoughts. And of course, this doesn't represent like Lake County, all the counties in Northwest. So some good news is that there is a local crisis continuum that we built up. We used to just go straight to Parkview Behavioral Health or Maple Heights Behavioral Health or call 911 when we had someone who was at high risk for suicide or even medium risk or sometimes low risk. We would still use going to a psychiatric ER as the method for helping. But we, over the last few years, are following a national trend, with thankfully funded trend, hope that stays around, that we wanted 3 things to happen. We want people to be able to call someone. People want someone to talk to when they're thinking of suicide, not just 911 dispatch, right? Someone who can listen and care. They want someone to respond. That's not enough. If someone listening to them hasn't really helped with their thoughts of suicide, then we need people to respond to wherever they are. And then the third pillar is a safe place for help that's not a psychiatric facility, but it's a comfortable place where you will meet people who've also had suicide thoughts that are helpers now, there's clinicians there. It feels more like a living room environment. So what we have is 988, which is someone to talk to, mobile crisis teams that can go to workplaces, schools, homes, and help de-escalate a situation and connect people to help. And if those are not enough, or if you just want to go straight to a crisis stabilization center, we have those too now. They're about 23 hours and 59 minutes of care. And then if you hit the 24-hour mark and you're still overwhelmed by suicide thoughts, that's when we suggest you connect to Parkview Behavioral Health, Maple Heights, Bowen Health, thinking about, I forget who has inpatient units, Winnie and Lake County, but there are, thankfully, in Lake and Porter counties, similar places to go. So the idea was to build a system that will serve everyone, anytime, anywhere. Okay, so I'm going to go over each of these pretty quickly, but I'm pretty proud that we've done some of this launching of these 3 pillars. So pillar 1 is that 988, right? It's 24/7, 365, confidential, and the vast majority of the time, talking to someone who's compassionate, who's caring, who gets them, who sees them, is what calms them down, and that's what they needed, right? Which is fantastic. So you can call it, you can text it, or you can chat it. As you can tell, they're called crisis specialists in our state, Indiana. They're called crisis counselors in other states, but because our law says we can't use the word counselor without them being a licensed mental health counselor, we call them crisis specialists. And you can call this line, text it or chat it for anything. You got bad news because your house is getting foreclosed on. Your mom just said that she was divorcing your father. You are finding out that you're losing funding. All of those are they're personal, they're hard, and you can call for any of those. That's we're running into people saying, "Oh, but my husband, he's been really down lately. He wants to talk to someone, but really 988 is only for crisis." No, it's for anybody in a hard place. And the great thing is it reduces the need to send out law enforcement to call 911 because that's law enforcement were not intended to come and respond to mental health crises. They got there by default. We need to scale that back and get the right folks talking to them. And 988 is very helpful. There's a lot of 988 materials that are out there. This is one of them. You can see the outline of Indiana. It's a way forward. It's someone who gets you. It's a listening ear. That's one of their messaging campaigns. But they have a lot of images and infographics. There's social media content on 988indiana.org. There's tons of videos, 15 second, 30 second, 45 second. They're easy to grab. They're young people, older people, people of color, people who look white, all these different folks. And you could purchase stickers, magnets, posters from them. However, I will say at the national level, we can get them for free. So Indiana specific 988 gear we have to pay for, unfortunately, but we can get many of those things for free from the Substance Abuse and Mental Health Services Administration. That's what I do. I order very regularly and I hand them out like candy wherever I go. And interestingly, it's on some of my handouts, but I didn't bring them here. It's very odd. Okay, so here are some images, which I really like, that they've done a nice job in Indiana trying to represent age, race, ethnicity. In Spanish, they have it. They have other languages as well, like Burmese, and I forget how many, maybe 10 different languages, which is great. I like, besides the "it's a way forward" message that we saw on the last slide, there's one of it's non-judgmental. It's the support you need. It's a reminder that you're not alone. It's whatever help you need when you need it. So I love that we have this resource. We have 4 call centers in our state that take these calls. And then we have one organization that takes all the texts. That's actually Remedy Live, local here. Sometimes people are like, well, 988, 911, like, how do I know when to engage which? I say lean into 988 unless there's a medical emergency, right? Certainly there's, we need to, if they've started an attempt, if they are threatening violence to others, those are the times that you want to activate 911. Otherwise, they can handle, the mobile crisis teams can handle the rest. And 988 can handle it too. So call 988, and if you do need a mobile crisis team, they can activate it for you. They can send a mobile crisis team to your house. So 911, if you're wondering, well, okay, you call 988, will they still call 911? And some people fear that. Like, I want to talk to 988 without the fear of them calling the police. Well, what we say is 911 is only activated by the 988 folks if they can't keep themselves safe. That is so if they're, have been talking for 20 minutes and they're still saying, nope, got this gun right next to me and I'm going to kill myself, that is when 988 will activate 911. Otherwise, 96% of the time, it's just talking. And a lot of times when they activate 911, it's with the consent and cooperation of the person on the line that is talking or chatting with 988. Does that make sense to folks? Yeah, okay, good. Okay, pillar 2, mobile crisis or mobile intervention teams, depending on what you're looking at. They go to people where they are. I mentioned that. And I love it because it avoids the use of law enforcement. It reduces going to ERs. ERs have giant bills. And oftentimes it's like, oh, you're medium risk, why don't we connect you to a therapist? And you just spent thousands of dollars to find that out, that you weren't even really reaching or meeting criteria to go to inpatient anyway. So these are way cheaper. In fact, Parkview, their SOS team, they say you should not be billed for our service. And if you get the bill, send it back to them, which I think is incredible. So I love that. So Parkview calls their mobile crisis team the SOS team. Bowen, their team only serves their own clients, but they do have a mobile intervention team. And then Northeastern Center up in the northern counties, they do cover down in Allen County. They're not always fully staffed, so it's a little bit longer wait. And sadly, we have 3 days left of being able to call Enact Mobile Crisis. They were very, very active in our Northeast Indiana, and they lost their funding. So they used to be on this slide, and last night I had to take them off. And Brandy, who's in our meeting, she works overnight shifts for them, the mobile crisis unit. And it's so sad because they've done so much good. And even the law enforcement in the more rural counties, they say, you've reduced our need to send people. They can quantify how much that Enact Mobile Crisis Team saved each of the county sheriff departments in our northern states by tens of thousands of dollars. Yet they're losing their funding. It's so frustrating. We get on that soapbox for a long time. And then pillar 3 is crisis stabilization. So again, I mentioned that if they're home-like environments, they don't feel clinical, okay, now I have to go sit in a white room on a white bed and don't feel comfortable. People are just checking on me every once in a while. It's not like that. It's really comfy chairs, couches, people who have lived experience with mental health and suicide or substance use disorder. They're there to help you. They look plain clothes. They are plain clothes. And they also have clinicians, and they also have prescribers. So if you're really anxious and you realize it's because you ran out of your medication, you don't have a refill, and your doctor's on maternity leave or whatever, you can go to these places and say, I think what I'm experiencing is medication related. Can you help? And they have a prescriber there who can help, which is wonderful. Northeastern Center boasts that they will help you with food, housing, social services. It's a walk-in clinic for anything to them, because a lot of those issues contribute to our mental health and our substance use challenges. So we have Northeastern Center. They were the first to sort of open their crisis stabilization center. It's up in Auburn. Bowen Health opened theirs in Pearson. They were the second to open theirs, but that's not super close. So they decided every Bowen location that has a clinic is also going to have a crisis stabilization room, or a calm room where you can sit and decompress and talk to someone. So each Bowen location now has a room that they call a crisis stabilization room. And then Parkview is working with their own clients. They've done a soft launch of theirs for their own clients. They want to fine tune everything, get enough staff. And then next year, 2026 is when they'll launch it and start advertising it all out there. So they're being careful for a reason. We don't have full staffs. They want to work out the kinks, but we do have several places that are open that we can access. Yes.
When you say own clients, is that through the SOS mobile unit? If once they go out, well, what do you mean by own clients?
That is a great question. Right. Yeah. So basically, anybody who's been seen in Park Center, and I believe is a Parkview client medically, I think, can use it. But yes, the SOS team is using it as kind of their safe space. So if you get responded to by the SOS team and they've helped you and you still feel like you want to talk to someone or you need medication changes, they will, that's sort of SOS's kind of holding place and helpful place for people. Great question. Thank you for that.
Is Heather still?
She is. She's on health leave right now, but she'll be back. Oh, yeah, in mid-September. Yeah. Okay, so this might be.
I have another question.
Oh, sorry.
This might be what.
Okay, this is complicated, but this is how it should work. You've got someone in crisis. They can call 988, and if it's resolved, they'll go, okay, I feel better from talking to someone. Or they could call 988 or text it or chat it and say, I still feel overwhelmed. If it's unresolved, they say, well, would you like me to send out a mobile crisis team to your house, your place of work, your place of worship? your park that you're sitting in. And if it's resolved, great. If it's unresolved, if that's not enough, then that mobile crisis team could either transport you, some of them do, or find a way to get you to the crisis stabilization center, right? And you can spend 23 hours and 59 minutes, according to state law, there decompressing, talking, sleeping if you want. I believe if you are under the influence of drugs and alcohol, they will probably take you to detox rather than have you stay there, but I'm not totally sure of that. But if it's unresolved, that's when they say, let's go to a psychiatric unit. So for Bowen out in Pearston, it's in the same building. So you go from one side of the building, if you feel like your anxiety, your suicide thoughts, your maybe delusions, hallucinations aren't being resolved, you just move to the other side of the building, which is their inpatient unit of Bowen. For us, it would be in Parkview system going from, let's see, how would this work? Carew is where the crisis stabilization center is, and then they would just go over to Beacon Street where Parkview Behavioral Health is. But there's also Maple Heights out there too, so people could go to Maple Heights if that's what they prefer. So is that, Brenda?
Yes, but I see the other arrows that say that a person in crisis could enter into any one of those. 988. Is that correct?
Yes. So you can decide, forget it. I've called 988 before, or I don't want to have to wait, or what if this person doesn't get me? What if they're young and I don't connect it and whatever? You could just say, I just want a mobile crisis team. I'm feeling overwhelmed, and you can call the mobile crisis team. And I will send you guys a handout that has it organized by these pillars with phone numbers and things like that. I've been working with a graphic designer to make it look prettier than a table in a Word document, which is what I created initially. But what I love is it's less restrictive. People have choices, right? They're not immediately put into a psychiatric unit if they didn't want it or need it, right? And it's less costly. It's free to call 988. It's free to get mobile crisis response, right? I'm pretty sure it's free to do crisis stabilization. I know that it does not matter what insurance you have or whether you have insurance at all. Even Northeastern Center said if people from Ohio, they're feeling overwhelmed, can come to Auburn and like they are there. They're not supposed to turn anyone away. This is by statute. This is open for everyone. It's not by insurance, etc. Is that, Brenda, is that helping? Yeah. Yeah. And then there always is 911. If you think someone's already, cut themselves, swallowed pills, or if they're super anxious and angry and they're hurting people, yeah, we do need 911 to get involved, right?
Holly,
Yeah.
what is the average response time of how quickly can they get to someone?
That's a really good question. I have heard anywhere, well, Randy might be able to say, I think it's 40 minutes, maybe, but I don't know. Randy, are you unmuted? Could you tell us about Enact?
Yeah, it's usually about 40 minutes to an hour. But we try to keep it as short as we can, just depending on drive time.
Yeah, it depends on drive time, a lot of it. And they have to have multiple teams on, at least Parkview to make sure that they can cover multiple calls at a time. And sometimes they're short staffed. Yeah. Okay. September is Suicide Prevention Month, and we have this fabulous looking flyer. And the reason I like it is that it's got 3 important messages. It combats stigma by saying mental health is just as important as physical health. It promotes 988. A lot of folks don't know about it. I think 23% of Hoosiers know about 988. Low. And military and veterans can press 1, by the way, and get straight to the Veterans Crisis Line. And on this flyer are 5 steps for how we can help someone. So if we see someone who is struggling, we want to ask, are you having suicide thoughts? Are you thinking of suicide? And if they say yes, even if they don't say yes, but they're still in distress, we show up, hear them. We don't try and talk them out of it or minimize their pain. They're in a lot of pain and they didn't get there accidentally. They've got some serious concerns, right? So we keep them safe by asking a few questions like, do you have a plan for taking your life? Or do you have access to a lot of pills or a weapon or a gun in your home? And then we connect them to resources like 988. Like I love, you can like three-way call 988 on your phone. You're sitting here with a friend. Let's call 988 together and put it on speakerphone, or if you're talking to your cousin in Utah, three-way call 988 in. Or we could go together to a crisis stabilization center. We could do a lot of different things, and then following up, super important to follow up with anybody you helped, because it shows that you're continuing to care, that it wasn't just that you care during a crisis moment, you care in general about them. Unfortunately, a lot of folks have suicide, and try and show up for them too. So September 10th, we're having our 11th annual candlelight ceremony for suicide loss. It has booths to engage in activities to remember who you lost. There's going to be resource tables this year. There's always someone who sings a lovely song at the end. But we have speaker and author Leslie Byrick speaking about her losing her son. And we'll light candles and name who we've lost to suicide as well. It's free. It's at West Swinney Park. I have flyers for this as well to be able to let people know, or take pictures of this and send it to someone that you know that might have had a suicide loss. But it's intimate. It's in a park where we take over the whole park, so it's not like you have a bunch of people you don't know there. West Swinney's nice because it has that pagoda pavilion, and it just has, you're away from the road. It feels more private. And then lastly, there are lots of opportunities in our area and other parts of the state to build some skills. So there are basic trainings out there to learn warning signs, how to ask, how to help someone, including practicing how to do that as well. So these trainings are all out there. SAVE is happening. That's the most recent, the closest one. That's Friday, 9:30. And I have a flyer for that. Additional skills are out there, how to talk about someone or talk to someone about lethal means, and how, like, in a sensitive and collaborative way, because some folks are like, you're not taking my guns, or they think that just by bringing it up, that's what we want to do. That's not what we want to do. We want to create safety. And so we work in a collaborative way to figure out what's doable for them and what will keep them safe. That's what Calm is about. That's on September 8th. And then these are offered at various other times. This one is coming up on September 9th. It's a collaborative assessment and management of suicide risk, the most evidence-based treatment type of training for mental health providers. And then we have all sorts of specialized projects or organizations, some for veterans, some for Black youth. We're trying to build more connectedness in our community. That's for everyone, because we know that that's a protective factor. And then school care team is out there to help schools. I brought toolkits so I can hand out some of those. They're free. We have thousands of them. We fundraised to print thousands of them. So please take them. And then this just says, each of them, for it, because you know you're standing.